the quickest treatment method to resolve my symptoms of BPH or maybe the LUTS?
So it really depends on the severity of the symptoms. So if it's just mild symptoms, sometimes lifestyle changes is enough. But if the severity of the symptoms is more, or we find objectively there's actually significant blockage of the bladder from the prostate, then we usually will recommend medical treatment with some of the medications that Dr. Tan has spoken about, as well as, and then if they don't respond to that, then we talk about surgical options.
My father has BPH. Am I more likely to also develop BPH in the future as well? Or in other words, if I have no family history, what's the likelihood?
So family history of BPH does confer additional risk. Maybe about if your father has a BPH, you have probably a 30% more chance of developing BPH compared to somebody who does not have a family history. However, BPH is very common and comes with aging. So even people who do not have a family history have a very significant chance of having BPH. So I don't think you can rely on not having a family history of BPH to say, oh, my father doesn't have, therefore I will not get BPH. Because environmental factors like obesity, inactivity are also a risk factor. So your father may be very fit, you may be not so fit, spend more time in the office, not doing too much exercise. So then your risk may be higher than your father when you eventually reach his age. So I think, and family history is not modifiable. So either you have it or you don't. So again, I think it's more important if you're concerned about the risk factor modification for BPH to look at things that you can modify, which is mainly your weight and your activity level.
Are there any advantages of the minimally invasive surgery techniques as compared to the traditional surgery?
The reason why we came out with minimally invasive procedures was actually to overcome some of the disadvantages related to the more invasive therapies. The more invasive therapies require general anesthesia. So the minimally invasive ones do not require general anesthesia. They can be done under local or just some sedation. The minimally invasive therapies do not cause problems with incontinence, which is actually a big deal, even though it's rare with the major surgeries. But if it happens to you, I mean, it means that you'll be on Pampers or pads the rest of your life, okay? The second thing in terms of the minimally invasive procedures is that they don't cause or they reduce the risk of what we call retrograde ejaculation. So many men, are still sexually active even into their 70s. I've had patients who are actually still continue to be sexually active in their 70s, and they actually think that retrograde ejaculation or not being able to ejaculate during an orgasm can be a big deal to them. So this minimally invasive therapies actually protect or reduce the risk of retrograde ejaculation significantly compared to the more invasive procedures. Yeah. So I think those are the 3 points. On top of that, of course, there are benefits in terms of less bleeding, shorter hospital stay, faster recovery, and faster return to normal activities with the minimally invasive procedures.
So is there like a recommended age to screen for prostate enlargement if there are no symptoms?
So there's actually no recommendation to screen for BPH. But you must understand what we mean by screening. Screening means no symptoms, exactly as what you said. So usually if you have significant prostate enlargement, there will be symptoms. But I think the key here actually is to recognize that you have symptoms. Often many men have symptoms, but they dismiss it. That means they wake up at night and they think, oh, this is just part of aging. So it doesn't register that this is a symptom. Or they go more often to the toilet, or they find that they're urinating slower and they take it, oh, this is part of aging. It doesn't register as a symptom. So I think that's the key here is actually mindfulness, being aware of changes in your body, that this is happening. And often men may want to deny it. Often we like to dismiss it as, oh, there's nothing wrong with me. And that is actually the key here. Not so much at what age you screen or not screen, but actually it's more about being mindful and being aware that there are changes going on and that these are important. There's not something to be dismissed.
Like what's the retreatment rate for TURP and how's the recovery like for TURP? And maybe we can touch a little bit on how this TURP is different as compared to the minimally invasive surgeries.
Sure. So TURP is one of the older treatments, in fact, one of the oldest treatments that we have for prostate enlargement. It's as a group procedure, we create a big channel. The retreatment rate is about 5% in 5 years. Okay, it's not 0%. So there is a retreatment rate for even a TURP. And surprisingly, it's similar to the minimally invasive procedure Resume or water vapor therapy, which is around 5% or so in 5 years. So that's one of the surprising things that came out of the study when they looked at Resume therapy versus TURP. So the TURP basically requires 1 to 2 days hospital stay, because usually after the procedure, there is some bleeding going on. There needs to be a bit of a washout to prevent the bleeding forming clots in the bladder, because if that happens, then you may have to go back to operating theater to wash out the clots and all that. So it's a little bit more involved. The recovery is a little bit slower before you get to go home. And usually we tell people to really take it easy for 3 to 4 weeks after a TURP, because we are always worried that they get a re-bleed or something else happens. I hope that answers your question. What else was in the question? Sorry.
It's just about the retreatment rates as well as the recovery.
Okay. Yeah. So recovery, well, we keep patients in hospital for 2 to 3 days before they get to go home. Usually they do not go back with a catheter, but they have to take it easy, because there's this persistent risk of bleeding again, or continued bleeding or heavy bleeding. So we tell them to take it easy for 3 to 4 weeks before they go back to normal activities. Yeah. But they should be able to walk out of the hospital. Yeah. They're not going to be wheelchair bound or anything like that.
Is the water vapor Resume therapy as well as the laser therapy available in the polyclinic, or must they actually go to like a hospital for these therapies?
Yeah, so I mean, it's a good question. I mean, we're always hoping that we can do it in an outpatient setting, like in a polyclinic, but unfortunately, it's not available in the polyclinic. As I mentioned, the laser therapy or green light laser actually requires general anesthesia, so it is a full-on operative procedure. The big difference between this and a TURP is that the bleeding is much less. So usually it's just an overnight stay and then you go home the next day without a catheter. Okay, so that's the laser therapy. It has to be done in the operating theater. And with regards to the water vapor therapy, at this point in time, the machine is only available in very few places. Definitely not in a polyclinic setting. It has to be done by a specialist, that means a urologist. So a polyclinic is you only have general practitioners there, and they are not versed in operative procedures. Water vapor therapy is relatively new in Singapore. It's been around, let's see, I started doing it in July of last year. So just a year plus. The outcomes are great, but it's done in an operating theater setting right now, but with just sedation or local anesthesia. And it takes about 15 minutes to 20 minutes to get done.
If I want to go to the toilet less often, can he actually drink less water?
Yes, okay, so this is often a very common coping mechanism. People find that they go to the toilet often, so they drink less water. And certainly it may make your symptoms, or it may help with the symptoms, but it doesn't treat the underlying problem. And there's a certain limit to how little water you can drink, because you then become dehydrated, and it can lead to other problems, like you may end up having kidney stones, electrolyte disturbances in your body, so it's not effective way to treat the BPH. It can control the symptoms to a certain extent, and for mild cases, you can get away with it. That means lifestyle changes for mild symptoms. But often I would say it's best to be evaluated, because you don't want to, like say again, neglect a symptom just by coping with it. You should rather evaluate it, and then if you find that your specialist agrees with you that this is mild, you don't have very significant problems, why don't you just reduce the amount of water you drink a little bit to cope with it. But otherwise, I think I would still say it's better to just get it evaluated to find out whether this is a safe way forward.
Are there any downsides of having implants for Urolift?
Okay, that's a good question. So when I first started doing Urolift 2+ years ago, I was also wondering, so are there downsides to putting these implants? So the implants are actually made of medical grade stainless steel and something called nitinol, special metals. They don't rust, okay? But you have to make sure of two things. One is that the implants can affect MRIs of the prostate. So let's say down the road, you're worried that you may have prostate cancer. Oftentimes now, elevated PSA, which is the blood test to look for prostate cancer or to screen for prostate cancer, Dr. Lincoln and I will go on to do an MRI prostate for you. These implants create a black hole around the implant where the image is not clear. So potentially you may miss a prostate cancer by the implants. The second issue with the implants is who is placing the implants. If they're not placed correctly, the implants can actually be placed partially into the bladder, and that can cause problems because the implants, if they sit in the bladder, can actually form a stone around the implant. So then the implants would, potentially cause pain, like we talk about pelvic pain, can cause problems with stones forming in the bladder and all that. So implant placement is important. So make sure that whoever is doing it has experience doing procedure. And as I mentioned, it may affect MRI readings of the prostate in the setting of prostate cancer.
So one of the attendees actually asked about PSA reading. So I just actually have to inquire if the PSA reading is about 5.6, what should actually be done? Should there what's the further evaluation that may need to happen? So maybe I will direct the question to Dr. Lincoln.
So PSA, so I think the first thing you know is that PSA is prostate specific, but it's not prostate cancer specific. Okay, so just because it's high doesn't mean you automatically have prostate cancer. Now, prostate, the PSA, the normal level, you'll regard it as 4. So anything more than 4 is considered abnormal. And between 4 to 10, which is here 5.6, between 4 to 10, there's about 25% risk that you may have prostate cancer. So when we say, I see a patient with an elevated PSA like this, then I will see what are the risk factors for prostate cancer. Are there any other reasons that it may be high, like perhaps it's having an infection or something like that? And then we may do further risk stratification or to whether this patient has a risk of prostate cancer, such as an MRI or additional blood test called the prostate health index. And then again, if after we evaluate, say, hey, this patient really does have a risk of prostate cancer, then we may then suggest a biopsy to see whether to extract cells from the prostate to see whether there is prostate cancer.
One of the attendees actually asked if he has been taking medicines for BPH for a long time. Can he actually do surgery and stop taking the medicine forever?
Yes, indeed. Actually, that's one of the reasons for surgery is that some men may find that they cannot tolerate either because of side effects or they're just having difficulty to comply with regular medication, or the medication is no longer working for them. It may have worked in the beginning, but as you get older, the prostate keeps on getting bigger and bigger. But the effect of the medicine doesn't keep improving, right? There's only a certain limit to how much the medicine can work. So certainly, just because you've been taking medicine for a long time doesn't mean that that is the only treatment for you. You can definitely progress to having surgery to treat the problem.
So will any lifestyle changes actually help to reverse the enlargement that's actually already present?
Unfortunately, I have to say no. We talk about weight loss, we talk about prevention of diabetes, we talked about healthy eating, that means less, your high temperature cooking, less animal fats in the diet and all that. But, in the end, none of that is going to reverse prostate enlargement, unfortunately. There is no therapy apart from potential medical therapy that may reduce prostate size.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.